Kate. I'm Jenna. I'm going to be your physical therapist today.
Hi.
So this patient has been diagnosed with a primary respiratory disease, like a COPD, and she's been having trouble breathing. She's mainly been breathing with her chest muscles, having a lot of pain. So we're going to teach her to use her diaphragm today using a technique called the sniff technique. We've placed her in a quiet environment without distractions in a comfortable position that will facilitate diaphragmatic breathing. And so Kate, we're going to work on a muscle in your chest, just under your ribs. It's a big muscle that's very helpful with breathing. We're going to try and teach you how to use that today. So is it okay if I put my hands on you?
Yeah.
I'm just going to put one hand where your ribs meet, come together, and one hand on your chest.
Okay.
And so I want you to take a big sniff in, like you have a cold or the sniffles, like that. And so what I'm looking for is for this hand to move and this one not to move, because your diaphragm is working right here. So you can do it one more time for me, please? Good. Now I want you to put your hands here and so you can feel it. So one where your ribs meet and one up on your chest. Yes. I'm going to put my hand here just to see if you're doing it right. So can you take another sniff for me, please? Good. Did you feel that under your hand?
Yeah.
Okay, so what I'm looking for is for you to focus on your hand here and feel that muscle underneath your hand. So your hand move. And I want you to sniff 3 times, 3 deep sniffs, and then 1 long breathing out, relaxed.
Okay.
Good. And do you feel that?
Yeah.
It looked good. I saw your hand moving. And so what we're going to have you do, we would initially have this patient practice this in a blocked fashion, so the same thing over and over again. And then we would progress to random practice, where she would practice it in different positions, side lying, sitting, standing up, and different grades of sniffs, I guess, like breathing in harder or softer, so we can get her to facilitate normal breathing eventually. And I would give her feedback initially after every trial, and then I would fade it out so that eventually I was giving her summary feedback every 3 or 4 trials. We would also have this patient perform a retention test in a couple days. So Kate, I'm going to have you practice this skill several times a day for the next few days, and then on your next session, I'm going to have you demonstrate this skill for me so I can see that you learned it.
Okay.
So we can make sure your breathing's good. Do you have any questions?
I don't think so.
Thank you.